Elsevier provides over 25% of the world's clinical content, including internationally renowned books and journals that healthcare professionals remain reliant upon throughout their careers. Yet, it is at medical school that Elsevier's engaging education solutions first start to shape the learning and development of tomorrow's healthcare professionals. Meet Tom. Tom is a first-year medical student. He knows that to become a qualified doctor, his learning must be based on a set of fundamental skills. He must also become familiar with a huge range of subject areas taught across his curriculum: anatomy, immunology, pathology, biochemistry, cardiology, the list goes on. He needs to be able to apply this information too. How can I identify a healthy body versus unhealthy? How does each body system work, and how do they interlink? How do I examine a patient? How do I communicate with patients? How can I identify the correct diagnosis? Tom's learning process will happen over 5 years of medical school. During this time, he will use a variety of learning techniques and supporting resources to reinforce both his knowledge and ability to deliver safe and compassionate care. Let's see some examples of this. Early on in his medical degree, Tom will spend over 30 hours a week in lectures, engaged in theory-based learning. He will need to understand basic sciences, and here we see him learning the theory of pathology. His lecturer is teaching the cardiovascular system using images from Robbins and Cochrane pathologic bases of disease. To build up his basic science knowledge, Tom will be expected to read extensively on the subject of cardiac anatomy, in preparation for a seminar group where he will engage in case-based learning. He will want to use multiple sources of information to uncover the nature of the case and stimulate conversation with his fellow students. So he frequently goes to the library and uses Elsevier eLibrary and Clinical Key to access information from Elsevier's books and journals. As Tom's theoretical learning develops, practical application becomes increasingly important. Here we see Tom preparing for a dissection lab. He knows he needs to be able to answer the tutor's questions, so he uses one of our anatomy apps with the labels off. Of course, testing of knowledge through exams will occur throughout Tom's medical education. Tom will be able to use one of our R&T tools to create a learning plan to maximize his study time or test his understanding with Gray's Anatomy and student flashcards, for example. In the later years of his education, clinical placements and the opportunity to learn from experienced doctors in a real-life setting will become invaluable. Yet, it will be a challenging time for any medical student, so preparation is key. Here, Tom is preparing for a placement on a respiratory ward, so he uses Clinical Key to prepare, and then makes sure he has a copy of Ballinger's Essentials of Medicine in his pocket for quick reference. Equipped with the right knowledge, Tom can move on to the next stage of his medical career to deliver safe, effective and compassionate care built on a foundation of lifelong learning.